Alright, now let's talk about insulin. So the mechanism of action of insulin is by binding to the receptors. So let's say this is the insulin, this is a receptor site in the cell. So the insulin binds to the receptor, and that allows the glucose to go into the cell. So when the glucose goes in the cell, the potassium follows as well. So this is basically the lock and key mechanism of insulin. So this is your insulin, this is your receptor site, and so insulin binds so that glucose can enter, and when glucose enters, potassium follows. Therapeutic effects include decrease in glucose, decrease in potassium. Indications, obviously glucose control, so when the blood sugar is really high, patient has diabetes, as well as severe symptomatic hyperkalemia. So this is not only used just in diabetes or high blood sugar, but this is also a treatment for hyperkalemia or high potassium level, because this aids pull the potassium back inside the cell. Precautions and contraindications, hypoglycemia and hypokalemia. And again, side effects are hypoglycemia, hypokalemia, and locally on the injection site for the sub-Q injections, you have lipodystrophy, which is basically from the tissue damage. There's changes in the area of injection. So that's why it is very important to rotate the injection site, because that can cause toughening or hardening of that tissue or area where we often inject the insulin. So some nursing actions, we need to be aware of the onset, peak, and duration. So we also need to correlate it with their intake, right? So is the patient eating? Are they NPO for a procedure? Because if that's the case, the amount of insulin needed may need to be changed for that period of time. Also, when administering, there are different options. There are different methods of administering insulin. And so with rapid acting insulin, there's usually a set dose. Sometimes it can be administered through a pump and with a sliding scale, which you guys learned in your calculations portion of this course. Also, you have short acting insulin. And again, this is also just like the rapid acting, can be set up in a pump, and there's usually a set dose, and you can also administer it as a sliding scale. And this is also an insulin that you can administer intravenously. Then you also have intermediate and long-acting insulin, and these are usually given daily or sometimes twice a day. So drawing and mixing of insulin. So it is very important to store it appropriately. So we need to store it in, usually room temperature is okay, and it will last about a month. But if the patient is gonna be taking it at home, we need to instruct them to refrigerate it to ensure stability. When we're drawing medication, the long-acting preparations must be drawn alone. So we can't be mixing the long-acting insulin with the other types of insulin. So when it comes to the sites for finger sticks and injections, we need to make sure that we're rotating the site right in order to give that area some break. When we're doing our finger sticks, so that's our method of checking the blood sugar levels, we need to choose the side of the ball of the finger. So that's where it's easier, it's not as hard to obtain blood, and sometimes it's less painful. So you can see here, we're poking the side of the finger. When it comes to injection site, obviously we need to choose an area where there's fat, especially it is a subcutaneous injection. So the most common areas used are usually on the upper arm area, so we need to pinch it a little bit so we can make sure that we are injecting it in the subcutaneous tissue. And then abdominal area and thigh area, it is very rare to inject it on the back area, just because, especially for patients, if they're gonna be taking it at home, if they're gonna be administering it themselves, it is gonna be hard for them to reach their back. Most commonly seen here on the upper arm, thighs, and abdominal area. And again, it is very important to rotate it to ensure that that area doesn't become hardened from the repetitive injection. And before we move on to the next topic that we're going to be talking about, I just wanted to remind you guys again, whenever we are mixing regular insulin and NPH, we need to draw the regular insulin first, followed by the NPH. So clear to cloudy, or what I like to remember is RN, regular than NPH. So over here, we can see the different types of insulin. You can see here that this is the rapid acting, regular, NPH, and glargine. So these are the available insulins, and then usually here is on their onset. This is the peak or the highest level, and towards the end, right, it goes down. So when it ends, that's basically their duration. So this is how long it stays in the system. So as you can see, the rapid acting, right, it peaks really quickly and it goes away really quickly as well. Over time, there were numerous studies that showed that it is better for patients to have a more stable glucose level, nothing that's up and down, right? Because that's what we're doing whenever we're administering rapid acting insulin. So ideally, we want the sugars to be steady. And so it is very important to administer glargine, which is a long-acting insulin, right? As you can see, it is very stable. So onset, so it starts working, and then the peak, it's not too high. But if you look at this, right, it is at a steady state. So it becomes steady, and usually it stays in the system for about 20 to 24 hours. So it is very important to know your onset, peak, and duration of the different types of insulin. So rapid acting insulin, which is your Lispro or insulin Lispro, the onset, so when it starts working, is within 15 minutes of injection. The peak is 1 to 2 hours, and duration, so how long it lasts, is 3 to 5 hours. Next, you have your short acting, which is your regular insulin. So we're talking here about sub-Q. Don't worry about the IV for now. Sub-Q regular insulin, the onset is 30 minutes to 60 minutes, and the peak is 1.5 hours or 1.5 hours, and your duration is 6 to 10 hours. Now, your intermediate acting, which is your NPH insulin, the onset is 1 to 2 hours, and peak is 4 to 8 hours. Duration is 10 to 18 hours. Long-acting insulin, on the other hand, its onset is 1 to 2 hours, so very similar to your NPH, and there's no peak, right? Because it's kind of constant, it's very steady and stable, and then the duration is often 24 hours. So why is it important to know? Well, basically, you want to know when. So when does it start working? So usually it's around the onset time. And the peak, we need to know the peak. Why is that? Because during the peak, this is the time where the patient is at the highest risk for hypoglycemia. So when are they gonna drop their sugar even lower? It's usually around the peak time. So if we're talking about Lispro, if we just gave Lispro, we can expect that the blood sugar can drop significantly within the hour or two. When we're talking about short-acting or regular insulin, we can also expect then that in about an hour and a half, that's when the blood sugar drops the most. Occasionally, providers will order combination insulin called 70-30. So it means that there's 70% of NPH insulin and 30% of regular insulin. Just remember, because we're mixing these two types of insulin, when we're considering their onset, peak, and duration, it's for both regular and NPH. So the onset would be for NPH, going back, it's within 1 to 2 hours, while the regular insulin starts within 30 minutes to 60 minutes. So that is their onset. And then peak will be 1.5 hours to 4 to 8 hours. So it peaks twice. And then obviously the duration, your regular insulin will only last around 6 to 10 hours. And then your NPH will last about 10 to 18 hours.